Hi, this is Dr. Chris, and this is Delaney. We're from St. Paul Chiropractic and Natural Medicine Center. And today I want to do an example of part of a new patient examination specifically focused on the area of the neck. And so we're going to start with some general ranges of motion. I'm going to go through some orthopedic and neurologic testing, and then we're going to do a functional muscle examination testing the nerves by testing muscles in the arms. And this would be something that someone would expect when they come in the door as part of a good examination. So Delaney, I'm going to have you go through some general ranges of motion first. What I'd like you to do is put your chin to your chest. And your job is just to tell me if you have any pain or discomfort at all in any of these ranges of motion. I'm going to have Delaney turn her head all the way to the right, all the way back to the left. And I'm just looking for things to be pretty much equal on one side compared to the other. I want you to take your right ear and put it down to your right shoulder. I'm going to put a little extra stress on here. Any pain with that?
Just a little tension.
Okay, and you can definitely notice some tightness on the left side of her neck. And then over to the side here, it seems to be a little better as the range of motion is concerned.
Just a little tension, but not as bad as the left side.
Okay, so young lady like Delaney, full normal range of motion. Now I'm going to evaluate things on a segmental level and actually feel the motion of each joint inside the neck. You've got 7 different vertebrae in the neck, and all of them have to move. Lack of motion causes problems. And so what we're looking for is things that feel nice and squishy and fluid and have got some movement to it. And I'm feeling that on the left side of her neck. But on the upper side, on the left here, not much movement at all, pretty restricted and probably pretty tender there, yeah?
Yes.
So she feels some tenderness. I'm noticing some increased muscle tension on one side compared to the other. And if I really got in here and applied any pressure, it's probably going to be fairly tender for Delaney. Then additionally, as I feel right here at the base of the neck, you can definitely feel increased muscle tension over on the left side versus the right. And there's 2-3 vertebrae here in this area that are not moving very well. Now, you know, anybody or most people would have come in and they probably could have maybe even told me that themselves many times. But what we want to do is really kind of evaluate how these structural changes, misalignments or lack of motion are causing pressure and stress on the nerves. And the number one way that we do that in the office is going to be by testing the muscles in the arms, because they're all controlled by the nerves that come out of the neck. Obviously, figuring out where things don't feel very good is a vital part of a good examination. However, when we look at the nervous system as a whole, we realize that only about 10% of your nervous system has the ability to feel pain. In addition to a good orthopedic and neurologic test, we want to figure out how those nerves are actually functioning versus how they're feeling. And the number one way that we're going to do that in the office is going to be testing those muscles, because they're controlled by the nerves that come out of the neck. And by doing so, we really get a good idea on the overall stress on the nervous system when we're not just paying attention to pain findings. In order to make these nerve challenges easier to find, I'm going to put Delaney in a position of stress, so to speak, that makes these nerve challenges easier to find. And for the neck, all I mean by that is that we're going to put the chin down towards the chest, and I'm going to have her stick her feet straight up in the air. Now this loads pressure inside the spine and will make nerve challenges easier to find. And I'm going to start off on the right arm, and we're going to start off by testing the bicep. And in order to do that, I'm going to isolate, relax your arm. I'm going to isolate the bicep and bring it way up top here, so it's truly a pure bicep test that we're doing. And I'm going to push down right here. I want you to hold. Good, that's nice and strong. Now I want you to maintain that position with your chin tucked and feet up in the air. Bend your elbow. Then I'm going to have her point her elbow towards the front so that we really isolate the tricep. And I'm going to have pressure put right here, and I'm going to ask Delaney to hold. Good, and we're going to move on to the deltoid muscle. Hold up here, hand down just like that, and then I'm going to push right here and ask for a resist. Now all of those responded nice and clear and strong. We're just going to merely compare right side to left side and see if we notice anything different. Now put your chin to your chest again, stick your feet straight up in the air, and let's start off with the bicep test. I'm going to hold right here. I'm going to push and hold. And what are you noticing right now?
It's not as strong as
Yeah,
the right.
so there's some weakness on this left-hand side here. I'm gonna come up, we're gonna test the bicep. Bend this elbow, point this towards the front. I'm gonna push right here and resist. What are you noticing with your tricep?
More weakness.
So not engaging, really not holding very much muscle strength. I'm gonna hold here, deltoid. And that seems pretty good, okay? So each of these muscles are related to a very specific level or nerve root inside the neck itself. And for right now, when we tested the bicep and the tricep, both of those are showing up with some weakness. Now the next one is going to be a hand motion. The motion is called ulnar deviation. It's controlled by what's known as your C8 nerve root. I'm going to have a hold just like that. I'm going to push right here. I'm going to move her hand this direction, but now I'm going to ask you to resist and hold strong. Okay, and hold strong. So really, really weak, but we're always going to compare it to the other side just for comparison purposes. Now I'm going to push right here. I want you to hold, Delaney. Hold. So right now all we know is that the muscles on the left arm are not working like the right, and that's all we know at this point in time because I haven't done anything like any diagnostic imaging, but we want to see if the neck is involved. So right now we're going to test that C8 nerve root, which is at the base of the neck. I want you to hold right here. I'm going to push right here just again to show hardly any strength whatsoever. Hold here, don't move your hand. Allow me to position your head in a way that I think will take pressure off the nerve. And now I'm going to test it with your head in a new spot. And now let's test again. And how much stronger was that?
Way stronger.
So at this point, we've evaluated that, that there's some areas of the spine with misalignments or lack of motion. We've done a muscle function test to determine which areas of the spine are going to be dysfunctional. And then based on this right alone, I'm going to want to see a picture of that. We've got muscle weakness in the arm that seems to be associated with a structural change in her neck. So that's the exact thing that we're going to be able to take a picture of so that we can take the pressure off the nerve and restore that normal function into her left arm. And then finally, for this neck evaluation, I'm going to check for some stability issues, because when I find that kind of finding here at the base of the neck, many times there's core stability issues on that same side. So I'm going to step around over here, and we're going to do a core strength engagement test merely by having your tuck her chin down like that. I'm going to stay right here. I'm going to lift up on your forehead. I want you to resist. Hold strong. So I'm pushing, and she's engaging and locking that out. I can feel the strength in that. Tuck the chin right there. I'm going to lift up on this side and resist. And if you didn't hear that, ooh. Okay, so Delaney, how much weaker is it on the left side compared to the right?
A lot weaker. I can't really keep my head in place.
So we've got a lot of different challenges that are causing, or challenges. Something structural here is going on, is causing compromise to the nerve root that's affecting her left arm and the ability for her core in her neck on the left side to really engage and hold stability in that area. And then we're going to show also how we do a correction with that in another video shortly. But at this point in time, this is exactly something I'd want to take a picture of with an x-ray and then sit down with the patient to be able to explain exactly what's going on and what we need to do to fix that. Thanks. If you would like to figure out exactly what is going on with your spinal column and go through a very thorough examination to not only determine how your spine is feeling, but how it's actually functioning, call us today at 651-644-7207 or find us on the web at stpaulnaturalhealth.com. We all look forward to hearing from you very soon. Have a wonderful day.